Hello, Professor, and the rest of YouTube. My name is Jose Rodriguez, and I am a student with the UMGC Biology 164 Human Anatomy, and today is July 6th, 2021. I just want to start off by mentioning that I am extremely sorry for my pronunciation of things, as my accent makes things very hard for me to just pronounce in general, especially just complex words. And let's get started. So, today I will be presenting my muscular system presentation on muscular dystrophy and rhabdomyolysis. So, let's get going. So, what are the muscular dystrophy and rhabdomyolysis diseases? Let's find out. This is a small picture of muscle fibers just to kind of relate back to the muscle diseases. So here we have muscular dystrophy disease. Muscular dystrophies are part of a group of muscle diseases. There's many kinds of muscular dystrophies, each affecting specific muscle groups with signs and symptoms appearing at different ages and varying in severity. The types of muscular dystrophy include the Duchenne muscular dystrophy, which is also known as a DMD, the Becker muscular dystrophy, BMD. We got the myotonic muscular dystrophy. We got the limb girdle. We also got the, bear with me here, fascious capuhumeral dystrophy. We got the congenital muscle dystrophy. We got the distal muscle dystrophy. We got the, bear with me, sorry, oculopharyngeal muscular dystrophy, and we got the emery-dephris muscle dystrophy. Moving on. Here we have rhabdomyolysis disease, also known as rhabdo for short, so we will stick to that name. A critical medical condition that can be fatal or result in permanent disability. This disease occurs when damaged tissue releases its proteins and electrolytes into the blood, therefore damaging the heart and kidneys and causing permanent disability or even death. So, what are the causes of muscular dystrophy and rhabdo diseases? And we will be asking ourselves why. Muscular dystrophy can be caused by the changes otherwise known as mutations in genes responsible for the structure and functioning of a person's muscles. This mutation trait is genetically received by the parents themselves. When it comes to rhabdo can be caused by various amount of underlying factors, this including medications specifically to lower cholesterol, colchicine, antibiotics, steroids, excessive strenuous exercise, heat stroke, and drugs such as cocaine and amphetamines. What are some of the symptoms of muscular dystrophy and rhabdo diseases? So this is what we shall look for. Symptoms of muscular dystrophy can be very big. Muscular dystrophy symptoms can vary from weakness in the legs and pelvis, enlarged calf muscles, frequent falling, difficulty getting up, difficulty climbing stairs, waddle-like walking such as a penguin, standing or walking with the chest and stomach out. as well as keeping the head upright. So basic motor movements that we do in everyday life. When it comes to symptoms of rhabdo can have symptoms of extreme muscle pain, muscle stiffness, swelling, weakness, and rarely some dark cola-colored urine that has a underlying factor of dehydration. So as we look at the symptoms and causes, we do ask ourselves, is there any treatments for muscular dystrophy or rhabdo diseases? And is there any medicine that can help? So due to muscular dystrophy, there is no cure or treatment as it is a genetic trait that modern science and medicine cannot cure. Treatment is available that can reduce the pain and symptoms, and this can be limited to mobility assistance, support groups, surgery, and medications such as steroids or ACE. When it comes to rhabdo, it does have treatment because it is curable. The treatment of rhabdo is correcting the abnormal electrolyte levels and aggressive hydration of the affected patient with intravenous fluids. So, what preventions can we take to not have muscular dystrophy or rhabdo diseases? Prevention of muscular dystrophy can be very limited as it is based on genetics, as I said before. This means that foresight and planning would be the best option to remain as healthy as possible as you cannot prevent it. Some steps can be taken for the future, such as genetic testing and counseling to evaluate the risk of developing the condition or the severity of it. This can also lead to more of future planning as your kids might have a risk of muscular dystrophy and what actions can be taken to best avoid that. When it comes to rhabdo preventions can vary as there's a lot of factors that take into play, such as the job or recreational activities involving the exertion of force and energy and or heat exposure can be a factor. Signs of and symptoms of heat related illnesses can also play a fact, uh, as well as the adjustment of physical exercise, staying in home from work when sick, and staying hydrated will be play a big role in these preventions. And with that said, this about wraps up my presentation on both muscle diseases, muscular dystrophy, and rhabdo. I want to thank you for giving me your time of day to learn something new if you did. And here's my references page if you have any questions or want to look further into more research done by actual professionals. And thank you again.